October meeting for the Guild of Pediatricians in Private Practice. Today is unique in the sense that we have a committee of PAN, that's the Pediatric Association of Nigeria. Dr. Mobalaji Lawal, I'll hand over to you, sir.
Okay, good afternoon, everyone. I hope you can hear me well.
Yeah, you're audible, we can hear you.
Okay, so good afternoon, everyone. I welcome everyone to this meeting. The topic, the title for this meeting is a one that I find very interesting, and is something I like to have conversation about, because as somebody in the private sector who is wired, like many of us on this platform who are in private sector, you are wired to to deliver, to act and take action. So I wonder why someone would spend so much time and effort and resources to make policy and then not put it into practice. So it's something that fascinates me. And I think I'm going to have an interesting time this afternoon listening to the various ways and means by which we can, move from policy to practice. This issue of not, of getting stuck at policy level it cuts across many parts of public areas, and it's part of the reasons why we haven't made much progress. In fact, I dwelt quite a bit on it in my lecture at the last PanConf, in my keynote address, the Bolaji Ajenifuja inaugural lecture. So I think it's an area which we need to pay attention to very carefully. And I hope that we'll have a very interesting afternoon listening to Professor Ogasoro and Dr. Gia, who are both experts in this area. So on that note, let me welcome you and to hand over to the coordinator, Dr. Elitu. Thank you very much.
Thank you very much, sir. I see that Professor Grange has joined from the US. Good afternoon, ma, or good morning. Welcome, ma. So the topic for today is from policy to practice, making school health services work. And today, like I said earlier, we have a committee of the Pediatric Association of Nigeria, that's the School Health Committee, making a presentation to us. And the two presenters, like the chair said, are Professor Maduka Ogasoro, who is a pediatrician, a gastroenterologist, a health economist, as well as a health policy analyst. Also joining him in making this presentation is Dr. Fatima Bello Gia, the wife of my very good friend, and she's also a consultant pediatrician and a nephrologist. So I will hand over to Maduka as well as Fatima for your presentation. Thank you very much. Over to you, Maduka.
Okay, good afternoon. Without really wasting much time and observing all the already established protocol, I'll be handing over to Dr. Gia, who will take the first part of the presentation. So over to you, Fatima. Thank you.
Thank you very much. I will try and share the slides now. Please, can we see the slides?
Yeah, we can see it now. You can go on. We can see the slide there.
Trying to use the PowerPoint. Okay, thank you very much. I would want to start by appreciating the pediatrician, private, that's GIPP, sorry, please, for the opportunity to present and also to share our experience as it concerns school health services in Nigeria. So as said earlier, the topic is from policy to practice, making school health services work. I'll be taking the initial aspect of the presentation and subsequently would hand over to Prof. Maduka for the other aspects. So the objectives of today's presentation is to outline of National School Health Policy, to also evaluate the key performance indicators, that's pre and post policy. But we'll be laying emphasis on the state of school health services in Nigeria, as well as to identify the gaps in SHS implementation and to recommend strategies for bridging the gap between policy and implementation. School health services is one of the components of school health program. The other component, nutrition services, as well as school-home community relationship. So school health services are preventive and curative measures that are provided for the learners and also the personnel within the school setting with the purpose of ensuring that both the personnel and children achieve maximum health that is possible for obtaining full benefit from their education, especially as it concerns the children. So SHS is an essential component of effective school health program, as well as achieving education for all children, and particularly for children with special needs. So why school health services for school children? Well, basically, school children constitute about 23% of the total population of Nigeria. And when we also consider adolescents, in fact, this will be going to 42% of the population of children in Nigeria. So quite a significant amount of them. So, school usually is the first contact that a child has with environment away from home. And not only that, these children tend to spend a significant number of years in schools. And through schools, it has been observed that impactful health projects will effectively reach a substantial proportion of children. And a child that is healthy is more likely to attend school, and not only attending school, is also most likely to be retained in such environment and as well as complete basic education. So SHS is organized into preventive through promotive to rehabilitative services. So the components include school medical services, health for not only the school children, but also the parents and other members of the community, depending on the situation at hand. So for services provided under school medical services, ideally it's expected that a child should undergo medical examination or screenings at least 3 times, first at the end of, at the point of entry, midway, and also at completion. And not only that, it's expected that they should have annual health screening or examinations. The aim is to identify children with previously unrecognized defects for early treatment and also continued treatment, including specialist care. Daily morning inspection. This is also still important in the present days. So this is the earliest form of school health services. That's daily morning inspection, introduced as early as in the 1920-something, 29 or thereabout, by the first medical officer of health in Nigeria. Subsequently, as usual, the issue of sustainability of what has already been started has been a major problem. So for the health clinics, these are usually undertaken at 2 levels. Simple colds or minor skin infections and fever, these are to be addressed in the sick bay, that is if available within the school environment, or at least by the use of first aid kits. And then the other level is the specialist clinic, where children with conditions ranging from dental to behavioral or mental health issues can be attended to by specialists in those areas. For the health records, these are expected to be cumulative, including consisting the identifying data and the records of findings during routine medical examinations or screenings, and also services that are provided, and the record of any notifiable disease or diseases that would have occurred in such school environments. The essence is to ensure that there's always a record to look back to in terms of, and especially in relation to the child's health or the health of the personnel in the school environment. For the referral services, it's expected that there should be linkage between the school and also the community. Ideally, there should be a contact person or contact persons, and then a system in such a way that a sick child is taken care of within the school environment. And if that is beyond the scope of what could be available within the schools, that there should be smooth transition between that environment and also the community, where specialist attention especially will also be gotten. In terms of controlling communicable or non-communicable diseases, quite a number of strategies are expected to be adopted, ranging from inspections or where a child will be isolated or children will be isolated. Inspections usually, as I said earlier, the daily routine inspection can still not be jettisoned, because usually it's expected that trained teachers or health personnel would have been able to identify the possibility of a contagious disease, or so that could be brought to the notice of the school management and other relevant stakeholders involved in the care of the child within the school and outside the school environment. Then other measures include immunization and also control of epidemics. Usually it's expected to occur through a collaborative effort and involving multi-sectors in Nigeria. So addressing behavior-related issues such as adolescent health problems, ranging from reproductive health issues and other challenges facing the youth, as well as mental health issues. This is also an opportunity to address such within the school environment, and also through the link that is expected to be established with specialists that could take care of such specific or health-related issues. So who are the personnel of school health services? So the health workers involved, including medical doctors, quite a number of health workers, because this is supposed to be, it's not a one-man's job. Everybody is a stakeholder, and not only the health workers. You could see that the school teachers, especially the ones that have been trained to identify at least basic health needs of the children, as well as some of the personnel, are also part of the personnel for school health services, and including school social workers. So coming to National School Health Policy, there is no standalone policy for school health services. Rather, it was captured as part of, it's under the National School Health Policy, where other components of school health program were also addressed. So the policy is a deliberate system of guidelines to guide decisions and achieve rational outcomes. It's a statement of intent, and it's implemented as a procedure or protocol. So why National School Health Program Policy? This was based on the realization that there was no guideline or no particular document to really guide the programs related to health within the school environment. This policy came up in 2006, was championed by the Federal Ministry of Education in collaboration with other partners, UNICEF, WHO, UNESCO, and also the Ministries of Health and Environment. And the vision was to promote the health of learners to achieve education for all and health for all.
Okay, yeah, I think I take it up from here.
There is an institutional framework.
Hello, dear.
The government, through the Federal Ministry of Education, in collaboration with the aforementioned agencies, including organized private sector, professional organizations like us, and also stakeholders within the communities or philanthropists within the communities. Each stakeholder has assigned roles.
Hello,
so
dear.
Drafting the overall policy structure is that of the federal government. Capacity building and also periodic review of this policy, while the state government is expected to integrate the policy into the education and work plans, and also to mobilize resources and integrate the health related data into the management information system. Mobilization of resources is also an assigned role of the local governments, as well as supervision and providing feedback at the state level, and such feedback is expected to trickle up to the national level for a review of policy or for adjustments in the policy. Quite a number of ministries have roles to play, but I would be I would be emphasizing on the roles of the Federal Ministry of Health. So ideally, it's the role of the Federal Ministry of Health, the responsibility rather, to ensure that there's adequate provision of health services and personnel within the schools, as well as provision of information for the prevention of communicable diseases, including immunization services. It also includes support for capacity building for personnel and also delivery of health services in schools. The Federal Ministry is supposed to champion the facilitating referral services, and also to ensure that there's conduct of pre-entry and routine health screenings. And not only that, that subsequent routine screenings should be maintained or sustained. Other stakeholders have a role to collaborate, community members collaborating with the school authorities. Development partners, mainly they are expected to assist in terms of financial and also providing technical assistance. And then professional organizations like ours, Pediatric Association of Nigeria, to support the efforts of government through provision of standards and also providing technical assistance. And then these roles are supposed to be implemented through the national or state or local government, quite a number of committees. The steering committees involving the national and state steering committees, those are the general overseers, and also other committees were to be formed, including those that will be responsible for implementation, monitoring, and also evaluation of committees. Additionally, there was to be a school-based health committee, which would have included the personnel as well for school health services, as mentioned earlier, and also some community representatives. So at this juncture, I will be handing over to Prof. Maduka for the other aspects of the presentation. Thank you, and over.
Okay, good afternoon once more. I thank Dr. Fatima for that overview. Okay, so as a follow-up to the background which she has already laid for us, we now have to look at the extent of the implementation of the already existing policy, both pre and post. But before that, the currently existing school health program policy, was enacted in 2006. And it has remained the policy that is still guiding the implementation of school health up to date. But before the enaction of that policy, there was a baseline survey that was conducted, to look at what some of the indicators were as at then, and that will now justify the impact of the policy. And on the area of the school health services, they looked at pre-medical examination, for, children that are gaining admission into secondary school newly. And they recorded about 14%. And the area of screening of food handlers was 17%. And availability of fit aid bus, about 80% as the case. And the presence of school nurses in school was 17%. And the linkage of schools with government clinics were reported at as 6%. In 2022, when this PAN Committee on School Health Program, was newly constituted, we did a situational analysis and tried to look at all the indicators for the entire 8 components of school health program. But for the sake of this presentation, we now extracted the one that speaks directly to school health services. And comparatively on the screen we now look at, that was in 2022, so that should be around maybe around 14 years from the last time the policy was enacted. And the pre-medical examination, that the school that requests for a pre-medical examination form filled, was 38.2. We could not really get any survey, and it wasn't included in what we did then. But in a survey that was done by Ofwewe, but that was just shortly after the policy, there was a slight drop on the screening of food handlers to about 16.6. Remember that the baseline was 17%. And schools that had a first aid bus, irrespective of how equipped it was, but the presence of first aid bus, basically, we got it to 47.1. And in some schools, we tried to find out, is there any person that was designated to take care of any child that happens to fall ill while in school? And our report was 17.6, which is just about what it was years when it was newly, when the policy was enacted. And linkage to government clinics reported a reasonable rise from 6% to 26.9%. Looking at what we had before, at least we appreciate the fact that presence of that policy tend to, bring some relative change in some of the indicators as the case may be. Next slide, please. Next slide. Okay, sorry. Okay, so we now, from our survey, we now notice that there are some implementation gaps that we identified. The policy as it stands now is long overdue for review, and there's an inadequate knowledge. Many people don't know about school health services. Many people don't know about school health program. And while we are preparing for this presentation, I just casually asked one staff of one school, what do you know about school health service or school health program? He just told me that. I don't think he has ever heard of that. So, and from our survey, we noticed that teachers that are in school that tend to have an idea of what school health program is, not about the content, but have you heard about school health program, was just about 11.4%. And parents that know about that were just 9.5%. So it's obvious that the knowledge about school health program is not there. The awareness is very poor. And if I will extrapolate this to the concern expressed by Professor Lawal when we are starting, that he would like to know what actually can be done to improve implementation of policies. The first thing is that people need to know that there's a policy that is existing. And based on this, apart from being obsolete, as the case may be, many people don't even know about it. So the first thing that has to be done is to find a way to create awareness. And that's exactly what this webinar tends to do, so that people will get to know about school health policy, school health programs, school health services, and start asking a question around it. And there's also inadequate capacity building of personnel for delivering our health services. In schools, what most schools do have, is maybe a biology teacher, based on the science background, designated with maybe like paracetamol or Gelosil and cotton wool, so that if a child sustains any minor illness, he or she will be able to take care of it. Those who have actually gone out for maybe a workshop, a seminar, or maybe a short training on how to handle minor illnesses, were very few. And in a situation, you get something that looks like a sick bay. We're actually in boarding schools. They tend to provide that, but in school that doesn't have any boarding facilities, most of them don't have anything like that. And also, there's lack of support and neglect for the school health services. As a build up to this, efforts were made to, reach out when we were at some of the interventions we want to implement. But we noticed that, there are school health services, even in the National Strategic Health Plan, or most of the plans that I've come across, none of them tends to have any provision for that in terms of any intervention or what have you. And after that survey we did, the committee now have to develop a position paper. And in this position paper, we'll try to make an attempt to advise what do we think that can be done to start, reversing the indicators to at least start looking upwards. So this was just recently published in the last edition of the Nigerian Journal of Pediatrics. So it's still a current publication where we try to list some of the suggestions and advice on how to improve on school health program. Please, next slide. The next slide. Okay, so what do we think that can be done to start bridging this gap between the policy and implementation? So there's need to boost awareness on school health program among student teachers, all the key stakeholders. They need to know about that. That is primarily the first thing that needs to be done. And also there's need to upgrade facilities, provide training intervention for schools. Teachers need to know what they're expected to do. Parents need to ask questions where they should. Students also should be aware what they're supposed to get as a student while they're in school, because these are some of the things that can help, to make them to look out for those services and start asking questions as the case may be. And the last introduced, the last multi-age cohort that was used to introduce the last HPV, the first phase of it of last year, of around October last year, was a really clear indicator of what the impact of school health program could have. That one recorded a lot of challenges, even in some schools. Some school has to close down when they heard that some group of healthcare workers were coming to administer vaccine. But if vaccine administration has been a part and parcel of school, maybe schools ask about, students were asked about their immunization cards, and some mop-up campaigns, were extended to school. They are coming to administer that vaccine wouldn't have been new, and many people would have complied to it. But fortunately, that lapse was corrected in the second phase that just happened a few months back. And also, there's also need to implement evidence-based school-based program. There's this program they call the Unplugged, where they try, that one just tailored directly to maybe substance abuse, age-based violence, where the adolescents are equipped and, make them competent on how they can, adapt in the society, and also how they can develop some social influence skills, as the case may be. Next slide. Let's move so that we won't. Next slide. The next slide. Okay. So there's also need to develop capacity on the screening for mental health disorder, but and also substance abuse. But while handling that, there's every need to, try to review it with what is acceptable in that local context, so that the implementation or the approach will not help go on, stigmatizing those who are found to have some challenges. And before then, I think there's also need to, clearly explain what mental health is all about. Because in our own context, once they mention mental health, people will think of maybe France psychosis or all those things. But something like anger management, depression, anxiety, all those things are mental health, and it affects the performance of any child in school. And like in the introduction where we had, school is supposed to be an enabling environment where when a child is sent to study, at least it will come out with the maximum capacity in terms of academic excellence and overall development of the child. So need to develop capacity on that really need to be implemented. And the school designated individuals, also need to, be trained on some basic assessments, with assessment on how to interpret it. Because most people they go to school malnourished. I know that recently they were talking about Meal Plus in school and the rest of it, but the extent of implementing it, is not really there. But teachers and even students should know how to assess all this and make meaning out of it, especially when it concerns children. And referral. Referral has to be extended to schools. When we go to our, maybe like the referral system, you notice that school referral from school is not included in the algorithm. So with this, there's need to develop a clear linkage from schools, because most students now spend greater part of their youth in school, and they spend longer hours. Some kids will go to school as early as 7 a.m. and they'll stay there till 4 p.m. in the evening. So the greater part of their day, was spent in school. So, and in the survey we did, the majority of them, attest that there've been a series of incidents where they fell ill at school. And the only thing that the option they had was to call their parents to come and take them. But while within them, they would have loved to be attending the school. And this is where it also concerns us more with regards to this presentation. We as the healthcare workers should be meant to understand the role we are to play. Most of us have our kids in school. We go there for parent teachers. We go there for visiting. Without much persuasion, it's expected that we'll visit their health facility. If they have any sick day, we'll look in, see what's actually going on, advise those that are there. And in a station where it's well structured, we can adopt maybe schools where from time to time we'll give them an update on management of some, basic disease conditions that are permissible to be managed in school. And also from time to time, update them so that they will be in line with the current teaching with regards to medical practices. But we know that now, beyond that, we are confronted with the challenge, especially in the human human resource for health. Where we are now cadres of healthcare workers. Most people are traveling, those people are locating, some don't want to stay in the urban, all those challenges I know, but whatever the situation is, there's still something that can be done. And also environmental scanning. Every school should be able to identify both capacities within their reach, both in the parents of the children that are schooling there, and also even in the community. So that if there's any need for any health intervention, they'll have somebody they can call that can easily advise them, at least to hold in place before an expert care will arrive. Next slide. Okay. So what we have here, okay. So in trying to conclude so that we'll make more time for discussion, the policy as it stands now needs to be improved on. There's need to review the policy. Most policies, should have about half lifespan, about 5 at most 10 years. Even if the contents are still adequate as the time, but there's need to from time to time look at it and update it. So that the current challenges will be duly accommodated in the policy. But what we have here, it's 2006. That is the only existing policy on school health program in Nigeria. So effort should be made to see how effort should be made to review it and update it and make it adaptable as the time being. And also, when we looked at the school health in its entirety, we realized that the school health services, other ones are more of, that as the school health program is under the watch of the Ministry of Education, with regards to overall implementation of the school program. But we are now looking at, could it be possible to isolate the school health services as a standalone program, so that we'll have a clear designated, maybe like department in the Ministry of Health that will see to its implementation. I was previewed to participate in the annual operational plan for a state in health. And of all the hundreds of activities they generated, I didn't see anyone that speaks to school health program or any of these components. And we know that we'll have these adolescents care, but they were looking at more or less community-based. And effort was made to, redirect their mind to that. But that when the background is not really right, it's like a hard sell. But we believe that if the school health services as a component, it's located over to the Ministry of Health. I think maybe when we are discussing, we may get more insight. It will help to get the much needed attention and help in improving the health, the impact, its impact on the pupil wider in school. I think the next slide, I think that's it. Over there. Okay, so these are some of the references we used to develop the presentation. And I want to thank all of us who are in this webinar for listening to the present. Thank you, and over.
Thank you very much, Maduka and Fatima. You kept to time, which is very good for us on this platform. And I think you've done a lot of justice to the topic for today. So we'll hand over to, we'll make it open for discussion. Your presentation will be open for discussion. So anybody that wants to speak, just please raise your digital hand and then you'll be recognized. I see 2 hands already. Sorry, I'm trying to see who these hands are. So I can't see those who've raised up their hands.
I raised up my hand. Good afternoon.
Okay.
One of them, my name is Jibril.
Okay, Petronilla, then Jibril. We are gender sensitive, so we'll ask Petronilla to start, and then we ask.
Okay, sir.
All right, Petronilla, please go ahead.
Thank you very much for this very nice presentation, Prof. Ogas and Fatima. I really enjoyed it. But since it says from guideline to practice, and you have really highlighted the gaps, which was so important over the years. But can you tell us what we can do to now meet? You're saying that we have to make sure that schools have. So what can we really do in practice, even as pediatricians, to now bridge this gap or implement some of these gaps that are hampering it? I will hear some maybe novel things that may be done within the capacity of pediatricians or even health workers and working with teachers. This is for Professor Ogas. Sorry.
Okay, I think we'll just take the questions. Maybe we'll take 4 questions and then we'll answer them. So the next person to Jibril, please go ahead.
Thank you very much, sir. I enjoyed the two presentations. Now, my feeling is with all the surveys that have been conducted, I haven't really had anything about the environment of the school itself. As you know, really, in many places, children still keep going to school under the trees. Some are in classrooms where rain and sunshine on them because the roofs are off. I think this has a very negative impact on the learning process. Secondly, again, in the service, I expected to have some figures as to the distance that will be traveled by pupils to the school, because some of them don't eat breakfast. By the time they come to school, they're tired, they sleep, they don't learn anything. So for me, there's some of these basic things need to be addressed. And I have experiences in such places, and it's really not nice to see that. We as pediatricians will have to have a way of actually see how we can influence either the Ministry of Education or Health to assist in trying to see that that's improved, because I think it has a very strong negative impact on how the learners actually proceed as they go through their learning process. Thank you, sir.
Thank you very much. Winifred? Okay, she's not ready. Dr. Ayeni, your hand was raised. You raised your hand. Please, can you ask your question?
Hello, sir.
Yes, please go ahead.
All right. Thank you very much. I want to sincerely thank the presenters, the professors, for the high quality presentations they made. And they are quite wonderful. I want to say that school health service is just one of the child-related policies in the country. There are several others. And my belief is that PAN and other subspecialties should actually become a think tank. And the think tanks are those bodies who will be involved in policy analysis, policy formulation, and policy assessment for every child-related policies in Nigeria. And with this, many of the questions raised after the presentation will be solved if we are intricately involved in all these policies, and even when they are due to be reviewed, the association is involved in such, and the association cannot be involved like on a platter of gold. The association must itself enforce itself on the policymakers to consider its own views. Hello, sir. Hello?
Yeah,
Go ahead, we can hear you.
We can hear you.
Thank you very much. So the association and the various specialties must enforce itself on the various policymakers and bodies to be able to defend the children's interests in all the policy being made. And the best way we can do this is to form ourselves into think tanks, which we can be the source of the policy itself. We can be involved in every stage of policy making. And with that, we'll be able to get better lot for the children in the country. Thank you very much, sir.
Thank you very much. So Fatima and Maduka.
Professor Grange. Professor Grange.
Oh, Prof. Sorry, Professor Grange. Good afternoon. Please go ahead.
Thank you very much, presenters. That was very, very well done. You are taking us back into the realm of relevance, of being relevant to the plight of children in this country, in Nigeria. Since I'm not saying in Nigeria, let me say in Nigeria. You know, when you were trying to investigate what had happened in the past, did you look at the history of how the school health was being managed before? I know you mentioned one or two things, but quite frankly, I don't think you did justice to it from the point of view of PAN's involvement. because I remember I think it was Professor Ubi of Bendel, who took this up very, very, very personally, the fact of school health. But anyway, nevertheless, you did mention that there was as far back as 1920, I think you said, or 20 something, the first medical officer of health. You mentioned, I think that was Professor, he wasn't called professor then. He was Abayomi, I think, but anyway, I think it's very, very important that you should look at what had been done by your predecessors, particularly by doctors, in trying to get the school health services established as a way of improving the health of children, but not only that, getting statistics on children and, getting them integrated into the community as adults, as self-reliant adults. If we lose that objective, we now will know that school health has not helped in getting the society to be a society that will provide good leaders and good citizens, which is what is our problem now. Our leadership is rubbish, citizenship, nothing, and yet there have been many, many, many schools in the past. A lot of resources have been spent on schools. So I want us to dig deeper into the utility of school health as a school in general, and also look beyond it, because today 20 million children are out of school. 20 million children out of school in Nigeria. What do we do about that? So no amount of putting a lot of resources in schools is going to help us to reach the ideal of providing a good society that will respect laws, that will, So I believe sincerely that we are just scratching the surface right now. Nevertheless, I want to give it to you that you have made a couple of very, very important suggestions. One of them is to isolate the school health program on its own at state level, state and local government level. As you know, local government is supposed to be responsible for primary schools, whilst states, I don't know, states are responsible, I hope, for secondary. No. In fact, they have not categorized what the state should do as far as secondary schools is concerned. I don't know, but we need to look into that. As far as healthcare is concerned, if you remember, primary healthcare is supposed to be looked after by local government, and secondary healthcare by the states. So somehow they have to be aligned. These things need to be aligned. That takes us back to our constitution. There's quite a lot to dig out with regards to how we are handling the policies, etc., because it is really our our constitution and our arrangements of those who are supposed to operate the constitutions that is wrong. So I agree with you that the Pediatric Association, being a very responsible association, and they can be trusted to take up the struggle for getting things right as regards children, we need to look further into the problem, because it is so important for us. It is an important area for us to operate to our own principles of management of children. Take immunization. Recently, there was a problem with immunization. Lagos State just announced that they wanted to immunize everybody, universal immunization, and that took them to court, So these are problems that have arisen subsequent to the fact that we do not have a good policy environment. We do not have a good implementation environment, everything. So what am I trying to say? We want both of you who have presented today to try and see how we can have go further and have a group of pediatricians who will now go, they will collaborate. There has to be collaboration. You identify what are the real nitty-gritty of getting children well groomed and well looked after, nutrition, etc. There is so much to be done, but we are hanging this on you, both of you, to see where we go from here. Thank you very much.
Thank you very much, Ma. I think you've given them a very, and they will obviously comply with your orders, Ma. So, Fatima and Maduka, over to you to respond.
Okay. Thank you all that have tried to seek for clarification from our presentation, especially Professor Grange, who has also given us an insight in the direction to look. We really appreciate the submissions. Okay, so I'll start with the first query from the President-elect, that Professor Tabansi, on what can we do as a pediatrician in an effort to bridge this gap. And just like the last speaker said, there are a lot that we can do, but there are some low-hanging fruits which we can reach out for. On individual basis, yes, like I mentioned, every pediatrician needs to be mindful that he or she, owes, will I call it, a duty of care to any institution within, her vicinity, starting with those who still have children that are in school, from the school, those schools that their children now, by just simple effort of asking questions with regards to maybe to the principal when you visit, or you try to see their sick bay, or those who have the health facility, just take a stroll to that place and ask questions. Just generally discuss with them. You cannot underestimate the impact of those people information you can give them with guidance on what they can do. So that is one of the things. We can just adopt schools, and make out time from time to time to, update them, using our visiting days. And even if there's a parent-teachers association, in any of their meetings, can just, give one or two insights on what is expected of a child with regards to the school, trying to update or uphold the health of that child while in school. It can really go a long way. And also, like recently, most of us, like one of the major challenges is that we don't even have any data. We don't even have any information on the impact. Somebody just did in this last exam, did something on institutional care, nutritional assessment. Those kind of data will go a long way in making an argument when, there's a platform to discuss. So we can start channeling some of our residents to do something in schools. Beyond the prevalence surveys we do, let them look around and do some other assessments, hearing, vision, problems, mental health issues, and it will surely generate data that can help to build up any advocacy kits that we can use to now press for a change. On an individual basis, I think that is some of the things we can do and more. And collectively, just like we are doing now, it's PAN that set up this committee. And we are mandated with creating awareness. People need to know that school, beyond coming to improve on our learning, it's also there to ensure that the health of every child is optimal. And one of the things we are looking at as a body to do is to develop a policy from the pediatrician perspective. It will also have to capture maybe other stakeholders, but it's in that document that we can now spell out with the input from every other person. What do we think that we can do as a body, and what do we think that we can do individually? We'll have it summarized and simplify, and it will be available where people can look at it and guide them in their day-to-day interaction, wherever they find themselves. So we're already working on that, and we believe that with time, we'll have something that will present to PAN. And also collaboration, we really try to reach out to, because as it stands now, school health is under Ministry of Education. And I don't know to which extent
you not even noticing. Our class even well.
That channeling resources to school health program as a program under Ministry of Health. But we've tried to reach out to because they say before the Ministry of Health can collaborate with any other body organization, there should be an approval from the minister. We've sent a letter to the Ministry of Health, seeking for collaboration. And I believe that if we get a response to that and we come to a discussion table, that is when we'll now start calling our mind to things we're supposed to do and, start getting ideas and cross-ventilation. At the end of the day, we'll come up with something that will help us to improve our indices or indicators with regards to school health. So we are working on that. There are a lot of things that we can do individually and collectively. All these outreaches, we can do outreach. Recently, as it stands now, PAN is doing the vaccine champions. They started with recently, there was an awareness to different schools. It was just tell them about vaccine, and also other menstrual hygiene and the rest of it. Some of these things, and in the process of doing that, we'll mention other things that are entitled to in school. So, and we initially thought of, as much of live fully, worked it out, that every school has something like health prefect. Can we have people that will call health advocates in school, students, so that they will know that when they get into their communities, all the information regarding health, hand wash, personal hygiene, adequate nutrition, all those preventive measures, they will take you to their respective homes and try to spread the news. And we believe that by the time we harmonize this document and, call like minds to sit together to discuss, we'll be able to, distill out all these clear, implementable interventions and then have it at our disposal. And the other person that asked something about why do we focus on school health services? Yes, we chose school health services. You know that when we come to school health program, we have about 8 components, and 1 hour is not even enough to discuss one aspect of it. So we just decided to narrow down on school health services or school health program, believing that maybe in subsequent presentations, we may decide to go maybe healthful environment, health education, as the case may be, guidance and counseling in school, community engagement. These are different components. But in the survey we did, it was broad. Environment, we captured something about the healthful environment, and we know that in the policy, they stated that schools should not be more than either 1 kilometer from their individual home. A child is not supposed to walk more than 1 kilometer to get to school. All those things are some of the things that we should be looking at. But on this particular presentation, we just looked at school health services. But all those issue about school environment is very valid. we'll have some of them reflected in our first publication that we did from the situation analysis we did in 6 states of the Federation. So we'll still maybe giving more opportunities, or if we have opportunity of, calling a kind of a workshop or seminar to dwell on all these things and get more people to give us an insight what they think about that, and also feed us with their own knowledge from their own vantage point. And the history, man. Yes, PAN has actually done a lot, and I may not really have the full detail on it, but I remember when we started newly, I was referred to something that started it was PAN generated, but it's like it was first tried in Rivers by Professor Kangini and Professor Wado Takane and Eda Alisinte. But it's like they got a political will from the then state governor, and the school health desk was created in the ministry. It was headed by the pediatrician or something like that, and then it was really impactful. And I remember they mentioned that other states tried to adopt that, but I didn't really, get the detail. Why did it now? Why was it not sustained, as the case may be? But I remember there was a document that is handed over to me in Akure, which I've not. I'm sorry to say, which I've not really had time to look at. Maybe after this presentation, we'll delegate people that will look into the history of PAN with school health program and try to advise us. But I think maybe time. Well, I may just be stopping at this, but I think there's still more. We are just evolving in this area of school health. And I believe that given more time, we should have something more tangible to present to us. Thank you, and over.
Thank you very much. Fatima, do you want to add anything?
Thank you very much, sir. All comments and contributions well noted. I'm certain with why we limited to the presentation to school health services. Time is one of those factors. And we had to really deliberate on which aspects of school health program will be, has these services for which pediatricians could be more relevant. Is it actually the health services, or are we looking at environment where we have just a little role to play, because it has to do with the structure, has to do with many other requirements for the environment for which we might not really have a major or a very relevant role to play. So when you look at the various components, the school health services is that component where we could actually do a lot. We've been talking, we will continue to talk. We are talking deliberately because sensitization, we believe, is the key. We talk until we are heard. We are not only planning that it stops here, but we are seeing it as we don't just want to be stakeholders that only need to collaborate passively with the government, but we want to be part of, committees, those steering committees, those planning, implementation, monitoring, and evaluation committees. We believe we have a significant role to play. And so sensitization and also advocacy, raising awareness, we believe will get us where we want to be. And PAN had made quite a number of attempts. In fact, dating back to 1975, I was a 5-man committee. I remember coming across a document also, though I don't have much information about what is contained in the document, but it was quite well structured and the way it should be designed, managed, the implementation and other strategies to be put in place to ensure the school health program actually achieves its goal. But what did it do? It died a natural death because unfortunately, PAN didn't receive any encouraging feedback from the government. But then, we will just have to keep on because we still have to start somewhere or continue somewhere. So that is to acknowledge the fact that, yes, there had been quite a number of attempts made by Pediatric Association of Nigeria. And also, in addition to what Prof talked about concerning the roles we intend to play, there was a time we also looked into the possibility of having, a unified pre-entrance medical screening form, such a way that it could be applied nationwide, even though we were thinking of also taking into consideration some cultural, religious peculiarities, but then something that could be adapted by virtually all within the country, so that at least our impact will be felt, even if it is that way, although it's not something we could do since there's a structure on ground, but at least to collaborate with other relevant stakeholders to ensure that that sees the light of the day. So there's hope, and I believe we'll reach where we want to reach. So I want to say thank you once again, and thank you. Over.
Thank you very much, Matthew Khan. Thank you, Fatima. Without rounding up, I'll just say one or two things. From my own experience, listening to both of you, I feel really, really very sad. And I'm saying this with all sense of responsibility, because I remember as a primary school student in Surulere in Lagos, we had, if I remember very well, we had a very good school health program going on. We had every morning we have the inspection before we go into class. We had a school meal. We had doctors who came from Lagos University Teaching Hospital to examine us and even conduct some tests. I remember the first time I ever saw anything to do with a nose swab was in primary school. And I'm sure some of those publications that from the microbiology department of LUTH I must have been one of the guinea pigs at that time. And we had the Randu Health Center that was attached to our school. So if we fell ill at any point in time, we were taken to that Randu Health Center for treatment, and it was free. So, and like all things that happen in Nigeria, we just failed our children. And now it's a good opportunity for us again to start all over. And I'm happy that PAN as an association has taken this up. And with both of you leading and championing this, we think you need all the support. It's a good thing to have a form that is uniform across the country, because, I mean, I've seen some schools where they will tell you go and do 500 tests. Some will tell you go and do 20 tests for the child to get into school. But I still don't know how we can do that. And I also want to share an experience, say something which I think I shared last month. I was told I was not capable of being formally educated by my first school, the first school I went into, the primary school I went into. And I'm sure that was just because those teachers didn't know how to handle a child who probably had some learning difficulties. So we still need to train our teachers to identify students who may have some learning difficulties, and then they will champion, or they can direct them in the right path as to how to seek help and what to do. The only thing that my parents did was just to change my school. And here I am today. So it's a big task ahead of us. I don't know how we're going to go about it. Just like Professor Grange said, she set up a very, very tall order. And I think as PAN, as well as doctors and pediatricians, we need to follow in the direction of what she has said. So I'll hand over to Dr. Mbolaji Lawal to say a few words before we close. Over to you, sir.
Well, yeah, thank you, Dr. Eletu, for those very, very germane comments, which I, which I really aligned with. And I'm happy that your parents changed school when you were young. I'm happy that they changed your school. Otherwise, we will have been missing an eminent pediatrician in our midst. So, that's really nice. And, it's been a very interesting afternoon, as I suspected. And I want to thank all the comments that came, especially the very germane one from Professor Grange as well. I think, all the things I would have liked to say have been said between both of them. And so, my overall comment is that I think the fact that PAN has taken it upon itself to focus on this issue is very commendable. And once again, PAN is taking a leadership position in a matter just because children are involved, not because we have direct influence there, if you know what I mean. You know, it's such a big subject, such a big area with so many actors. But PAN, in its usual role, because children are there, because of our love for children, have taken it upon itself. It's a leadership role we have taken, and it's very commendable. We need to commend PAN for that. And also the two speakers today, Professor Ugasoro and Gia, Dr. Gia, who PAN has mandated, and they have taken the job very seriously and, you know, are pressing ahead. And, you know, yes, it's a start, but it's a very good start. And I want to commend them for the work that they are doing and for making this presentation to us and doing it so very eloquently. The journey of 1,000 miles must begin with the first step, and that's what we have seen. However, the scope of your assignment has been very clearly shown to you by Professor Grange, and I think that it will be a very good guide going forward. So thank you all very much for your presentations and your comments, and all the people, all the attendees. I wish to thank everyone. It's been a very, very good afternoon. Thank you all.
Thank you very much, sir. Dr. Fatima Gia and Maduka Ugasoro, on behalf of the Guild of Pediatricians in Private Practice, I want to say a big thank you for sparing time to be with us and for your presentation. And like we usually say at the end of each presentation, we will knock on your doors again at some point for you to make another presentation to us. And for everybody who has joined, Professor Grange in particular, having joined from the US, we want to say thank you, Mark, for your words of advice and for the encouragement you're always giving to us. And we want to thank everybody for joining this meeting today. We hope to see you on the 28th of November when we'll have Professor Eke from University of Port Harcourt Teaching Hospital giving us a talk. Thank you very much, and bye for now.